Hi, I'm Dr. Maxim Chumek. My patient called me Dr. Max. I'm a diplomat of American Board of Hair Restoration Surgery. I've been a hair transplant surgeon for many years and I love what I do. This is the reason I wanted to record this video and raise an awareness about the causes, possible causes of hair transplant failure. It is an important topic, not very frequently discussed. Unfortunately, people are looking by before and after photos published by different clinics that could be very much misleading. What is important is not those before and after photos because they can be easily manipulated, but actually the ethics of the clinic, who does the procedure, because this is ultimately will determine your particular success or failure with the surgery. Let's check some of the most common causes why hair transplant may fail. The first reason comes up as desiccation, or desiccation stands simply dryness. Because we work with live tissue and the grafts are taken from the donor area, as you can see on this dummy head, being taken and reimplanted to the frontal area, to the recipient area or crown area, depends on the degree of the hair loss. This live tissue is being outside the body for some time. It could be 2-3 hours, up to 6 hours, depends on how big of the procedure. At any given moment, if this tissue is being exposed to dryness or graft being exposed to dryness, this live tissue can sustain an irreversible damage and in result will not grow. When it could happen? It could happen during counting grafts, when they've been taken from the back of the head, microscope, being checked for, being quality checked. It could happen during reimplantation. So it is important for staff, hair transplant surgeon at all times to be present, to be aware, to check, double check, triple check, make sure the grafts are in the perfect environment. This is cause number one. Next common reason for failed hair transplant is crush injury or mechanical injury to the graft. Same principle, just like dryness. The grafts need to be handled gently with every stage of the hair transplant procedure. First stage of hair transplant procedure is harvesting. You can see in this video how you can be too rough getting the grafts out, as a result causing mechanical injury, and because of the crush injury, graft simply will not grow. During placement, it's another very important step that we need to prevent any excessive force applied to the graft anatomy, because same reason, if you use forceps especially, you can squeeze the wrong part of the graft and as a result causing crush injury, the graft might not grow. During counting, same principle, have to be very gentle. The easiest, the most safest way to handle the graft is by grasping the epidermal layer, the top part of the graft. That will prevent any possible injury to the rest of the sensitive anatomy. Reason number three, again, we're talking about causes that are under our control, and it is a prolonged time of grafts outside the body. Here's what happens. Once the graft being taken from the occipital area or donor area, they've been stored in the special solution or saline. The longer the graft stays outside the body, the less the viability. It is accepted that up to 4 hours there is usually no degradation of quality of grafts, and after 4 hours, the longer it takes, the less viability remains with the grafts. There are, of course, solutions to that. Different storage media can prolong graft survival. Different temperature, we'd like to keep them cool between 8 to 10 degrees of Celsius. So these factors might be obvious for our patients, but it is responsibility of the hair transplant surgeon and the staff to make sure, especially with the longer procedure, to make sure the grafts are stored in the optimal temperature and the environment. And of course, do your research before you decide where to go. Surgeons and staff with more experience can handle a procedure faster, and the faster the procedure goes, usually the better grafts do. In our clinic, we are able to finish 3,000 to 4,000 grafts within 6 hours. We try to make it as quickly as possible for that reason. So now, as we discussed the causes of failed hair transplant that are more patient-related are the following. The first one is undiagnosed autoimmune alopecia. It is absolutely imperative for hair transplant physician to make sure that we do not transplant something not supposed to be transplanted. And it could be frequently overlooked, especially when you go to what is called budget clinics. Budget clinics are just interested in getting as many procedures as possible. They don't look at other causes of hair loss such as scarring alopecias, alopecia areata, and so on. If not diagnosed correctly, you can get the transplant done, pay the money, and it could fail completely. Scarring alopecias or autoimmune alopecias needs to be treated by a qualified medical doctor, and only after proper clearance can be considered for hair transplant. And another cause is related to previous medical history, such as diabetes, history of previous procedures, history of resolved scarring alopecia, microvascular disease, peripheral arterial disease, and so on. Any condition that can impair blood supply to the recipient area. For example, patients with multiple previous hair transplant procedures. As a result, might experience a lot of scar tissue because they've been, due to the fact that multiple previous procedures will create a lot of tiny scars and overall affect the vascularity, the perfusion, the oxygen delivery to this area. So each subsequent procedure can have less successful results. History of diabetes, for example, especially uncontrolled diabetes, can lead to microvascular damage, less blood supply to any peripheral area. History of scarring alopecias, such as lichen planopilaris, can result in significant deposition of scar tissue and poor blood supply to the area. So to make sure best possible outcome of your surgery, do your research. If you have any questions, do not hesitate to contact us about the details.